The fertility journey can feel like you're trying to find your way through a maze in the dark. So today, we're going to turn on the lights. We've taken a fantastic Q&A with an expert and boiled it down to give you clear, straightforward answers to some of the biggest questions people have when they're going through fertility treatments. So, here's our game plan. First, we're going to talk about how to decode an IVF cycle that didn't go as planned. What do all those numbers really mean? Then we'll zoom out a bit and look at how things like everyday medications and your overall health can play a huge role. And finally, we'll get into the most important part, how you can use all this info to work with your doctor and create a treatment plan that is tailor-made for you. Okay, let's just dive right into our first scenario, and honestly, this is one of the toughest. You've been through that whole first IVF cycle, you finally get the results, and the numbers just don't add up. They don't make sense. So where do you go from there? This right here, this question, comes from a 30-year-old with PCOS, polycystic ovary syndrome, right after her first IVF go-around. It's such a powerful question, and it's a situation that is unfortunately really common. It perfectly sets the stage for what we need to figure out. To find the answer, we basically have to put on our detective hats. We've got the case file, right? We know she has a high egg reserve because of her PCOS, but this really, really low fertilization rate, it's a huge disconnect. So let's start looking for clues. The experts tell us to look at 3 critical areas. First up, egg maturation. See, with PCOS, it's this tricky balancing act. Doctors are understandably worried about overstimulating the ovaries, so sometimes they'll trigger the egg retrieval just a little bit early. But here's the catch. Only mature eggs can actually be fertilized. So of those 19 eggs they got, how many were actually ready for prime time? That's question number 1. The second clue to investigate is the fertilization method itself. Some clinics might just default to conventional IVF, where they put the sperm and eggs in a dish and kind of hope they find each other. But ICSI, where they inject a single sperm directly into the egg, is a much more hands-on approach. It can get around fertilization problems you didn't even know existed. So the big takeaway here, even with supposedly great sperm, ICSI can be a really valuable insurance policy. So the most important thing you can do is this. You need to schedule with a source, and I love this, what they call a WTF appointment. Yep. What the fertilization? It's a sit-down where you and your doctor go over every single piece of data from your cycle from top to bottom. And this right here is the perfect agenda for that meeting. It's not just about getting a list of numbers. It's about understanding the story those numbers are telling you. From when the trigger shot was given to how the embryos developed, every step is a clue. The whole point is to shift from asking what happened to asking what are we going to do differently next time? And here's one last kind of surprising piece of advice. In this whole big equation, the donor sperm is a variable, one you can actually change. If the results just aren't there, it is absolutely worth thinking about trying a different donor. You'd be surprised how sometimes that one little switch can change everything. Okay, so now let's broaden our focus a little. We're going to move beyond the nitty-gritty of one cycle and look at the bigger picture of your health. And that includes some really common medications that you or your partner might be taking. This is a super timely question. These GLP-1 drugs like Ozempic or Zepbound, they are everywhere right now for weight loss. So what does that mean for a guy's fertility when you're trying to conceive? Now, what's really fascinating here is just how different the recommendations are. For men, the advice is actually to keep taking the medication. Why? Well, because it improves their metabolic health and lowers inflammation, which is actually great for making healthy sperm. For women, though, it's the opposite. The recommendation is to stop about 2 months before trying to get pregnant. And that's really just playing it safe, because we don't have a lot of data yet on how it might affect a developing fetus. All right, next up is a fantastic 2-part question that really gets into the details of prenatal health. We're talking thyroids and the big folate debate. So let's break these down one at a time. First off, let's just quickly get on the same page about TSH. The easiest way to think about it is this. Your brain sends out TSH to tell your thyroid to do its job. If your TSH level is high, it basically means your brain is yelling at your thyroid, saying, hey, make more hormones. For fertility, and especially in early pregnancy, doctors want that TSH number to be under 2.5, just to make sure the whole system is running nice and smoothly. And here's a super important connection you need to know about. The very medications that help your eggs grow also raise your estrogen levels, and that can throw your thyroid for a loop. Now, this is totally normal, but it means you and your doctor need to be extra careful, checking those TSH levels pretty often and tweaking your thyroid medication as you go. Now for the folate question. You see a ton of stuff online about methylfolate, but the science on this is actually crystal clear. Folic acid is the only form that has rock-solid, proven evidence that it prevents really serious neural tube defects in a baby. Methylfolate is part of the process, sure, but we just don't have the proof that it's as stable or that it gets to the baby as well as folic acid does. So, what's the expert recommendation? Take both. It can't hurt, and it makes sure you're fully covered. All right, for our final section, we're hitting on the single most important idea in all of this. Fertility treatment is not a one-size-fits-all kind of deal. The whole goal is to create a personalized plan based on your specific body and your history. This question right here really gets to the heart of what personalization means. Endometriosis creates this really tough, inflammatory environment in the body. So the treatments to manage that during an IVF cycle involve some serious trade-offs that you and your doctor have to weigh together. It's this constant balancing act. Some protocols, for example, use drugs like Luprin to suppress the endometriosis for a while, but that might not be the right move for every patient. Other protocols are shorter and can be safer for some, but the real key here is this. There is no single best protocol. The best protocol is simply the next one you try, one that's been thoughtfully chosen to be different from the one that didn't work before. And our final case study brings up a classic dilemma. Here we have a patient who wants to be efficient, right? She wants to give herself the best possible shot, but she's also, very reasonably, concerned about the risk of having twins. So, what do? Natural or medicated IUI? Before we even start to weigh the options, we have to start with a tough piece of reality. At age 38, the baseline chance of success in any given month, even with IUI, it's only about 5%. That's the number that we're trying to beat. So here's the choice. A natural cycle is simple. It relies on the one egg your body produces, and there's no added risk of twins. A medicated cycle, on the other hand, uses drugs to hopefully get 2 or 3 eggs, which boosts your odds, but it comes with about a 5 to 8% risk of twins. It really is a trade-off between trying to be more efficient and trying to minimize risk, and that risk can be managed with careful monitoring. But here is the most empowering part of all of this. You are not locked into one path. This isn't a decision you make once and can never change. You can absolutely try a natural cycle first, see how it goes, and then make the call to switch to a medicated approach for the next one. Flexibility is your best friend here. We've seen how digging into your data and personalizing your plan can completely change your fertility journey. Understanding the why behind every single decision, that is your greatest power. It's what turns you from a passenger into a co-pilot on this journey. So the only question left is, what's the next question you're going to ask?